Oh,
Got it.
got it. It's like euphoric.
So we have Quentin here today, and thanks for coming in. Now, I want to say your age because it's significant, I think, in the case. You're 28 years old, and you have horrible back pain. And I wanted to preface with his age because a lot of times we picture people, my age or, I'm in my 50s, but 40 or 50 years old. But young people, especially athletic people, can have, bad backs. And you hurt yours. How many years ago did you hurt yours? The first time?
I hurt my back probably 7 years ago. Playing basketball, and then never did any chiropractic work or PT after that. It got better just because I was, young at the time, but I run probably 100 times a year, a few hundred miles a year at least. So it never really healed correctly and got strong again. So I've been dealing with chronic lower back pain since then.
Now you did when was your MRI? So you did your MRI like a year ago?
Actually, no, like 2017.
Okay, and they found an L5S1 herniated disc, and you feel like it never really got better, right? And then recently, you went through a bad time with it again. It got worse.
Yeah, it's been getting worse over the last 2 or 3 months, and then I had an event in a pool on October 6th, about a month ago, where I really re-aggravated that disc.
What did you do in the pool?
A cannonball into the shallow end.
All right, sounds good. I used to do cannonballs, or what are they called, jackknives?
Yeah.
I was more of a cannonball guy than a jackknife. I think people are one way or the other. They're either like the jackknife or the cannonball. But you must have hit your pelvis, right?
On the bottom.
And then it made it worse again.
Yeah.
Are you able to run at all now?
No.
So running, and that's a big part of your life. So running's not happening.
I've been going crazy for the last month. Yeah.
Does it hurt to bend to put on your shoes, or does it hurt to get out of a chair? So what actions would you feel it right now?
Putting on socks is like a 5-step process for me right now.
And he's only 28. When you're 28, putting on your shoes should not be a 5-step process.
Yeah.
And how about just sitting? Do you notice it today?
Yeah, I'm getting a pinch in my lower back just from sitting as well.
Is it center or slightly left or slightly right?
It's slightly on my right.
Okay, slightly right. Do you ever get radiating pain down the back of your leg or the front of the leg, or pain? Some people get it in the front towards the groin.
Yeah, I'd say towards the groin.
Okay, so that's another pattern that people get. How about like bending forward? Or you said to me when I was first talking to you that you used to be able to touch your toes no problem.
Yeah.
Or almost even put your hands flat on the floor, right?
Yeah.
How far can you get down today? Let's see it.
About to there.
Okay, so that's no longer touching his toes. We're gonna get him on my table first. I'm gonna give him a chiropractic adjustment, full body. And then we're going to also have him be on the DRX decompression machine. And that's something that takes longer, but can actually unherniate a herniated disc and unbulge a bulging disc. That's a bigger commitment, but we're going to include that today so we can at least try it once, see how he does. If he decides he wants to pursue it a little bit, that could be the best way for him to unherniate a herniated disc. Okay, so I have him face down on the table. I put the ankle straps on now because I want to traction him a little bit. Now, traction is actually different than the decompression machine. Traction, the table's going to flex and distract and flex and distract, and it opens up the disc quite nicely, but this literally will decompress the area and creating a zero gravity situation where the big machine will, over a period of time, like weeks, will pull that disc back under. What pain are you in just laying here on a scale of 0 to 10?
A 1.
Okay. Now, when I turn this on, do you stay a 1 or does it move up? Turn your face so we can hear you. Is it still a 1 or did it get worse?
Probably still a 1.
Okay, so then we should leave it on.
Yeah.
Because what it's doing is it's just giving it some motion in there. Like a radiation into the groin area to the inner thigh. Is that typically on the right, or it could be on both sides?
It's on both. It's on both sides.
Okay.
And it's kind of a dull ache.
A dull ache. Okay. I'm gonna just get on this with my kind of elbow. So I'm gonna do a little deep tissue massage in here now. Now this should no longer be a 1. Now I'm pushing in it. Right there. Do you feel that one? So now I'm on his right glute and right in there. But do you feel how tight these muscles are?
Yeah, they're so tight.
I'm going strong on him. I'm really pushing hard. You can feel this, right?
Oh yeah.
And then you feel that right there?
Yeah.
And right there. And you feel that's quite a bit now, right?
Yeah.
You feel that right there? I have to use all my strength to get this. He's never had an adjustment, right?
Well, never.
Okay, so I'm going to do a spot right in the middle here. Big breath in and blow it out. Feel that pop?
Good.
All right. Lie on your back next.
Oh.
How was that?
Oh, that was crazy. I've never experienced something like that. It's like euphoric.
Big breath in. Blow it out.
Whoa.
Wow.
Ooh.
Big breath in and blow it out. Got it. That's your lower back.
Yeah.
That was L5S1.
Yeah, awesome.
Big breath in. Blow it out.
Oh,
Got it.
got it. I could fall asleep.
That was pretty cool, right?
Yeah, that's so nice.
Very carefully. Don't do much more than you did before, but just see if you can get another 2 inches out.
I can already get so much more love. It's like a full another.
You're almost there, right?
Yeah.
Okay.
That was from.
So that's just one treatment, and he's going to need a few. So let's stop there for me. So basically it's doing this, pulling on your disc. We're going to set it at L5S1, and then it'll relax a little bit every minute and then start pulling again. But it doesn't relax all the way to 0, it relaxes to 85 pounds. And think about it, let's say you're hanging on a chinning bar, and there was a small child hanging on your waist, and then a bigger child.
Yeah.
So that's the type of traction, but we're going to set it at the right disc level, and this disc level is associated with a 13 or 10 degree angle. So this one's a 10 degree angle. Jump on there, hold on to those handles, and we're going to get this measured to you next. Now we're going to tilt the table back, and we're going to put it all together. He's almost done. He's got a couple of minutes left. How are you feeling up till now? What do you just feel, like a pulling sensation?
Yeah, just some pulling.
Describe
on
that.
the back, but it's nice. Like after loosening the back on the table, it's a nice.
Okay. You see, when you're going to get up, it's going to be a little tender. When people get up the first time, it's like, whoa, I felt something.
Yeah, I'm sure this is probably the most my back's been worked out in probably 3 weeks.
Yeah, so we'll see. We'll see. But the process is worth it because you're going to see big changes. You have to respect it. It's a hell of a pull. So now you're going to walk up and down the hallway for a little bit. You did your first session today. How do you feel?
So much better. Okay, I mean, yeah, I feel so much less pressure on my lower back.
Okay.
Just fully, like, honestly lighter.
Okay, was the DRX painful or uncomfortable? Most people think it's uncomfortable.
Yeah,
Yeah.
a bit. I mean, it's just like you're not used to that kind of
Yeah.
mobility. Like,
And
that
we're
stretch,
literally
you know?
pulling him apart, so it's not comfortable. Although you'd be surprised how many people fall asleep on it. Hold your thighs and sit back a little with your butt, and then walk your hands down and see if you can eventually get down a little lower than when we started today.
I mean, at the beginning, I couldn't
Yeah.
even get to my knees.
Yeah. Okay, that's enough. That's enough. I don't want you to hurt it today. So my suggestion for him is he does a few of these, and let's see how far we can get. I really love to get him running in the next 3 weeks, and he can do it. He's young. He's the type that would recover fast, but he needs to do some work. If you've been suffering with debilitating back pain, sciatica, herniated disc, bulging disc. What you saw in today's video is a solution that here in our office we're making amazing turnarounds for cases that people thought their only option was surgery. Give us a call if you're in the area and you can come in and give it a try, or look in your area for a DRX9000, a doctor that might be practicing with that machine, and see what they can do for you. Big breath in, blow it out.
Oh,
Got it.
Got it. I could fall asleep.